second hantavirus case confirmed after 3 die in a suspected cruise ship outbreak. Health authorities say around 150 passengers and crew remain on board the vessel off West Africa as investigations continue. The victims include a Dutch couple and a German national, while a British passenger is in intensive care in South Africa. Officials say the virus has been confirmed in the British patient and was also detected in one of the victims. The causes of the other deaths are still under investigation.
WHO is working with countries to respond to cases of hantavirus infection that have been identified on a cruise ship in the Atlantic Ocean. As of the 4th of May, there have been 6 suspected cases reported. 3 cases have unfortunately died. 1 patient is currently ill in ICU in South Africa, while 2 patients remain on board and will be evacuated for medical treatment. About 150 people, including passengers and crew, are on the ship.
The vessel has been denied entry to Cape Verde as a precaution, with passengers asked to remain in their cabins while health measures continue. South African authorities say the outbreak may be linked to the ship's earlier route through South America. Officials say a British passenger became ill during the voyage and was airlifted to South Africa. Health experts add that the virus is typically not easily spread between people.
Just to also be clear that usually the hantaviruses most often are not usually spread human to human. Most of the viruses, I'll clarify now. So most of the viruses are normally transmitted through rodent droppings and it's usually in specific kinds of environments. There is a less common variant that occurs in South America that is associated with human-to-human transmission.
Doctors say early symptoms can resemble common illnesses.
So initially it's very non-specific, unfortunately. You might have some muscle aches, almost like flu-like symptoms, fever, abdominal pain. If they do get worse or they don't respond to your usual conservative management, that's when you want to seek help, especially if you've been at risk or have been exposed. It's generally when we would seek help anyways, isn't it? So non-specific at first. If there are complications that occur, it can have respiratory symptoms, shortness of breath, or you can even have a bleeding tendency. But those are generally the complications that develop later on, and by then hopefully you're already in the healthcare system.
The World Health Organization says the overall risk to the public remains low, while investigations continue into the source of the outbreak.